I know the morning was heavy in the images and the current situation and what's happening. I know it affected me and many of you, and I hope during our discussion today and this afternoon that we can start talking about the next steps and how to build forward and hopefully get to some actionable steps that we can take forward in the future. So the session, this session is expansion of basic service delivery, and we will focus on maternal and mental health. First, I would like to present my co-moderator, Rihab Sanduka. Rihab is the Director of Programs at Juzur for Health and Social Development. She has a background in public health and management. She has extensive experience managing health programs across all age groups, focusing on reproductive health, early childhood, and youth health. Rihab has led key national initiatives, including establishing Palestine's first referral system for gender-based violence and contributing to the national accreditation system for baby-friendly hospitals. She chairs the Palestinian Network for Early Childhood and coordinates coalitions on adolescence and early health. During crises, Rihab has managed emergency programs in Gaza and West Bank, where Juzur operates 80 shelters, providing essential health and psychological services, humanitarian aid, and basic needs to over 300,000 displaced individuals, despite challenging conditions and restricted access. Welcome, Rihab.
Thank you. Good morning, everyone. The ongoing genocide in Gaza have had a devastating impact on health services. A woman from Gaza told me once that during this war and under these pressures and challenges, I don't think there is anything harder than being a woman. Women and newborn children are among the most vulnerable, facing severe shortages in health services, food, water, safety, and hygiene. According to Juzur's study on May 2024, they found that 74% of women face serious issues, including mental health problems and inadequate care with premature births and complications. 26% of new mothers have had postpartum complications such as severe bleeding, high blood pressure, and infectious, while 76% of newborns suffered from various health problems such as respiratory issues, skin disease, diarrhea, and malnutrition. As of August 2024, around 40% of hospitals are significantly damaged, disrupting the essential services. WHO reported a 60% shortage in essential supplies as of September 2024. Nearly 30% of maternal care facilities are non-functional, with 20% rise in neonatal mortality, according to OCHA report. The Gaza Mental Health Program reported a 50% rise in cases, with 70% shortage in trained professionals and 50% reduction in service availability. This session, we will explore the critical challenges and gaps in health services in general, with more focus on maternal health and mental health services, and reflect on the role of frontline organizations like UNRWA and various NGOs in maintaining essential health services. We will focus on immediate responses, ongoing challenges, and the path to creating resilient, sustainable health system for Gaza long-term recovery. I think we have to, I have to introduce, after this introduction, I have to introduce my co-moderator, Chantel. She's an epidemiologist from Lebanon with several years of experience practicing in different geographical areas. She obtained her master's degree in epidemiology from the American University of Beirut. Following her master in healthcare management from University of Surrey, UK. She worked in a private health care sector and with MSF in Lebanon before moving to Amsterdam to work at KIT. She recently worked closely with Juzur in the piloting of digital mental health intervention in Palestine. We have to maybe to move now to our guest. I would like to introduce Dr. Ghada Al-Jadba. She's a chief of the field health program for UNRWA in Gaza since 2015 and has extensive experience managing health services during emergency. She played a key role during the 2014 war on Gaza as an area health officer, ensuring health centers remained operational. During the Great March of Return in 2018, she led efforts to meet urgent health and humanitarian needs, providing post-operative care, psychological support, and physical rehabilitation to injured individuals. In the current conflict, she has coordinated health responses through UNRWA, maintaining essential health services despite the destruction of Gaza healthcare system and focusing on internally displaced persons. Her work involves strengthening partnerships with other health agencies to ensure continuous service provision in the face of severe challenges. Welcome, Dr. Ghada.
Sorry to interrupt, but before we launch with the questions and the discussion, we have a video that was filmed from Al-Awda Hospital. And Dr. Mohammed Salha might be with us online, I'm not sure, but we hope he is around. But we also have Hani in the audience that can answer to questions regarding Al-Awda Hospital. Can we have the video, please?
منذ بداية العدوان على قطاع غزة في 7 أكتوبر عملت جمعية العودة الصحية والمجتمعية حسب السيناريو الثالث لخطة الطوارئ من خلال تشغيل مستشفيات العاملة في قطاع غزة، مستشفى العودة بتل الزعتر ومستشفى العودة بالنصيرات، بالإضافة إلى تشغيل مراكز الرعاية الأولية التابعة لجمعية العودة الصحية والمجتمعية. استقبلت المستشفيات والمراكز العديد من الإصابات أثناء العدوان الإسرائيلي على قطاع غزة. قامت القوات الاحتلال الإسرائيلي بتدمير جميع مراكز الرعاية الأولية العاملة في قطاع غزة. تم تدمير مركز العودة الصحي والمجتمعي بيت حنون، بالإضافة إلى تدمير مركز العودة الصحي والمجتمعي بجباليا ومركز العودة الصحي والمجتمعي بغزة، بالإضافة إلى تدمير مركز العودة الصحي والمجتمعي بخان يونس. ونحن الآن لا نعلم عن مصير مركز العودة الصحي والمجتمعي برفح، حيث تدور الآن صراع في منطقة رفح. قامت قوات الاحتلال الإسرائيلي باستهداف مستشفى العودة بشمال قطاع غزة لما يزيد عن 8 مرات. تم استهداف طابقي المبيت في المبنى الشرقي لمستشفى العودة بتل الزعتر، وخروج ما يزيد عن 50% من قدرة المستشفى عن الخدمة نظرا لاستهداف طابقي المبيت، بالإضافة إلى استهداف الطابق الخامس وتدمير خزانات المياه. تم تدمير أيضا محطة التحلية وتدمير الإسعافات العاملة في المستشفى. العديد من الطواقم الطبية داخل المستشفى قد أصيبوا، واستشهد 6 من العاملين داخل المستشفى، استشهد 3 من الأطباء، بالإضافة إلى 3 من العاملين داخل المستشفى أثناء حصار المستشفى في ديسمبر الماضي 2023. كما تم أيضا اعتقال الدكتور أحمد مهنا مدير مستشفى العودة بشمال غزة، وحتى اللحظة لا نعلم مصيره ومصير 3 من الزملاء العاملين داخل المستشفى. كما أيضا تم استهداف مستشفى العودة بالنصيرات الطابق الأخير وتدمير مخزن البطاريات في المستشفى، بالإضافة إلى تدمير أيضا جزئي للإسعافات وتدمير للمخازن، مخازن الأدوية ومخازن المستلزمات الطبية. تسعى جمعية العودة الصحية المجتمعية إلى رأب هذه الفجوة من خلال إنشاء عيادات متنقلة في جميع محافظات قطاع غزة، خلال خدمة النازحين في شمال قطاع غزة وفي وسط وفي جنوب قطاع غزة، بالإضافة إلى أنها تسعى جاهدة الآن إلى إنشاء عيادات طبية ثابتة في شمال قطاع غزة ومدينة غزة، وتسعى جاهدة لإنشاء مركز حماية للطفل والأم في مدينة خان يونس بجامعة الأقصى. كما تسعى جمعية العودة الصحية والمجتمعية إلى إنشاء المستشفى الميداني في مدينة غزة لتقديم خدمات النساء والولادة بقدرة سريرية 6 أسرة، وإنشاء غرفة عمليات وكشك ولادة داخل هذا المستشفى الميداني. كما تسعى جاهدة مع جميع الشركاء لإنشاء مستشفى ميداني بجوار مستشفى العودة بالنصيرات لرفع القدرة السريرية الاستيعابية في أقسام المبيت من 30 سرير إلى 100 سرير. كما أيضا تعمل إلى رفع القدرة السريرية في قسم الاستقبال والطوارئ من 12 سرير إلى 30 سرير، بالإضافة إلى إنشاء عدد 2 غرف عمليات لتصبح 4 غرف عمليات، ورفع القدرة السريرية في كشك الولادة من 3 أسرة إلى 6 أسرة. تسعى جمعية العودة الصحية والمجتمعية من خلال كافة خدماتها إلى رأب الفجوة الحاصلة في القطاع الصحي في قطاع غزة نتيجة العدوان، وإلى تلبية احتياجات المواطنين من الخدمات الصحية والمجتمعية.
As you see in this video, just to frame the conversation today, the idea is to see what are the current challenges and the quick, immediate responses that have been done or have been implemented, such as the field hospital, and then discuss with our panelists how can we move forward and what can be the long-term actions that need to be implemented as soon as possible.
Back to Dr. Ghada. Dr. Ghada, welcome. Can you please explain how did this war affect UNRWA's health services, and what are the challenges you face to continue providing essential health services in the current situation?
Okay, thank you. Thank you, Rahab, and thank you all for your interest to listen to us. Maybe I ask you, Chanel, to present the first slide, the first one, number one. First, number one slide, please. No, number one, slide number one. If it is not available, but it should be. Yeah, this is slide. Thank you. We are talking about how UNRWA affected UNRWA, or the war affected UNRWA healthcare system or the health services, like how the war affected all of the health sectors in Gaza. This is the first slide in a presentation, wasn't it to present it here, but was planned to have this panel discussion. I am keen to present this slide. This is one of UNRWA health centers. It is called Sheikh Ridwan Health Center. It is the slide for 2 photos, photo of the health center before the war and photo of the health center after the war. The health center before the war was such a beautiful, amazing, full of life, full of providing comprehensive, holistic, advanced health services, primary health services to Palestinian refugees in Gaza. And now, this is the photo after the war. Complete destruction of the amazing health center, the amazing work. This is what happened to UNRWA healthcare system. Exactly like this photo. UNRWA healthcare system was before the war, like the Sheikh Ridwan Health Center before the war. And now, It is like Sheikh Rudwan Health Center after the war. As Rehab mentioned about my bio, I have been chief of health in UNRWA since 2015, nearly 10 years. And we built a lot. And you believe me, my home was totally distracted and bombed on the second day of the war. Yes, I felt very, very, very sad. But now I even more sad because I lost all of the achievements we have done for more than 10 years and decades in UNRWA health program to improve the health services, to improve the health status of the vulnerable Palestinian refugees, especially women, children, elderly, and a lot of people in all of our repeated conflicts, repeated challenges. But now what is happening is beyond call it challenges. No, they are obstacles. There is intended destruction of the healthcare system in Gaza. In UNRWA, we lost the health centers, the health installations, most of them. We have only 5 health centers from the 22 health centers before war functioning. And this is because of no access to reach the health centers, or even after the evacuation ended or the military operation ended, when we reached the health center, we found them damaged, and we need to rebuild again. And even after rehabilitation of the health center, there is another order of evacuation and displacement, and we need to rebuild again. And we do that. We decided from beginning in UNRWA to continue providing the humanitarian support to all of Palestinians in Gaza with all of the possibilities and despite of all of the limitations. We lost all of the medical supplies. When there was evacuation, order of evacuation from, sudden order of evacuation from Gaza and north, we lost the main compound of UNRWA, which we have the main store. So we lost most of medical supplies. And we lived for months without medical supplies. And also we lost the staff themselves. They are part of the misery, they are part of the dire situation, they are part of the killing, they are part of the displacement, they are part of the dehumanization, they are part of everything, like making them unable to work. Even there is no connection, there is no communication. And the first days they were really like working, like we are doing miracles. We succeeded to contact them, we succeeded to have them, but you can imagine those staff with repeated displacement. And when we are talking about displacement, it is not just moving from one place to another place. No. And every time they are displaced, they are leaving part of them until they leave all of them. One time, one of my colleagues, she mentioned to me, I don't believe I am a human. I believe that I am a ghost. I stopped at this word because it means a lot. She doesn't feel she is a human because no one in the world treat them as humans with all what is going. So those staff we need, I am as a leader, a manager, I need to contact them and to ask them to work and to work with them. It is hugely difficult, but we succeeded to do that. This is because what is called, between brackets, the resilient health staff and the heroes. And believe me, I hate these words. We don't want to be heroes, and we don't want to be resilient. We just want to be normal persons and to live normal life. But this is our fate and unfairness from the life to all of the Palestinians since 1948. So also we lost the information system, we lost the advanced electronic system which was in our health center, so no information and reporting system. And after that, yes, we decided to continue working, so we established medical bonds in UNRWA schools. UNRWA schools, were like work as shelters to most of the internally displaced persons. In the beginning of the war, there were more than 1.8 million displaced persons in UNRWA schools. So we established medical bonds in UNRWA schools in order to provide the essential health services, and also we established new temporary health centers because we want more comprehensive services to be available. Also, we tried hard to secure medications with a lot of limitations for like having a humanitarian corridor to enter the medications, and we succeeded to enter the medications. We succeeded to have rented stores with these difficulties. There is no places, believe me, in Gaza, and cold stores and with huge challenges. And after that, we lost them. When there was evacuation in Rafah, we again lost the stores and we lost the medications and repeated the cycle of replenish the medications with no ability to have these medications in Gaza now after a closure of Rafah border and looting of the medications because of the security mess in Gaza. So now we are left with huge shortage of critical medications in Gaza. And we also tried with the support of WHO, with the support of UNICEF to secure the vaccines and resume the vaccination program and vaccinated more than 70% of the entitled children, which is amazing in this situation. Also, we established a nutritional screening because of the food security, which really affected all of the population in Gaza. And also, we established a surveillance system to monitor the infectious diseases, which now is like the temporary bomb that can kill children, women, and many people in Gaza. And with the support of WHO, we have these awards in books as a platform of reporting. So we are doing all of that, but all of that is subjected to be damaged at any time and then to rebuild again. We participated recently in the polio campaign. It was like a festival. We engaged with WHO, we engaged with UNICEF to participate, and Ministry of Health in that polio campaign, and we vaccinated more than 500 children who are entitled with that vaccine after the epidemic of polio in Gaza after decades of eradication of polio from Gaza. So in UNRWA, we are trying all of the time to continue providing all of the essential health services to all of the Palestinians in Gaza, despite of all of the constraints we have. Thank you.
Ghada, and I have maybe to mention that 70% of Gaza population are refugees, and UNRWA usually provides services, health, educational, and social services for the refugees, and up to my knowledge that even in the north of Gaza, your operation is suspended because of the decision to boycott UNRWA.
Yeah, exactly. And in emergency, yes, UNRWA mandated to provide the services to Palestinian refugees in Gaza, constitute more than 75% of the population. But in the emergency time, we expand the services, all of the services, to all of the Palestinians. And by the way, in this war, the Palestinians in Gaza, they lost everything. And UNRWA has to provide them with nearly everything, with a lot of limitations. They need to provide them with shelter, they need to provide them with food, water, and non-food items, and also the essential health services to all of the Palestinians in Gaza.
Thank you, Dr. Ghada, and I'm sure everyone in our panelists can echo the level of destruction and the level of loss of services and commodities in all types of medical services and healthcare system. I want to welcome Miriam van Dorsen, who is the country director for Oxfam in the occupied Palestinian territories and currently highly involved in Oxfam humanitarian response in Gaza. She has held several management positions for Oxfam programs in the Middle East and North Africa, and led Oxfam's program in Zimbabwe during the COVID-19 pandemic. She builds on many years of experience in working closely together with civil society partners as program officer with Oxfam and other development organizations. Miriam, welcome. I wanted to highlight the program that you're currently overseeing that is focused on community and community-based approaches. If you can let us know or explain to us how that program with that approach has been dealing with the current situation.
Thank you very much, and thank you for this opportunity and for organizing this really important conference. As Oxfam, we work with a number of partners in Palestine, including Gaza. As part of the Masaruna program and other programs, we work with organizations like Juzur, Palestinian Medical Relief Society, Cultural Center for Free Thought Association, Aisha, many community-based health organizations providing, often led by feminist principles, and providing healthcare, maternal health, but also mental health and psychological support to people in Gaza. And we have seen this work has been extremely important over the past years, and in the last 11 months, covering looking at what happened since October last year, we have seen that our partners, that national organizations have done tremendous work to support people in Gaza while being part of that community who is war affected and where tremendous trauma is being inflicted. And what we have seen working with our partners is that they have really looked where people are who need help, going to shelters, training midwives to do emergency care in the different locations where displaced people were and are, setting up new health points, going to community hubs in order to deliver those services along for maternal health and mental health where people had to be evacuated and displaced to. And that has been extremely difficult, most of all because of security issues. People cannot work in a safe, nowhere is safe in Gaza, and people cannot do their work and their humanitarian emergency work in safety. But because also, as we have heard, because there are no supplies, there is very little in order to support people. And what we have been doing also as Oxfam is to work on that very, very complex international kind of like supply chain to try to get goods into Gaza together with others such as UNICEF and other partners. And that has been extremely complex and difficult and also costly and often very frustrating because, convoy supplies get stuck. They are in Egypt, stuck after the Rafah border closed. Now we get some supplies into northern Gaza. But all of this is, means that you have to be prepared. You need to be ready in different locations to be able to get, materials in as soon as there is an opening and a possibility to do that. But that has been very complicated as well. We are extremely proud of the work that is being done on the ground by these very strong organizations. But in order to really, continue working in this, there needs to be a ceasefire so that people can be there safe and do their work in safety. And there needs to be access for humanitarian supplies and materials.
Actually, as a partner with the Oxfam in Masarna project, Oxfam is one of the organization from the beginning of the war actually have a response for the emergency, and you asked us to shift our interventions to emergency response, and based on that we trained more than 40 midwives in the north of Gaza. They succeeded to do delivery for 150 women. And we provided them with delivery kits, and so this is one of the main achievement actually of Masaruna. Okay.
Maybe could I add one point?
Yeah, please.
Yeah, because to make that possible, funding needs to be flexible. So we can only do that and respond to the needs on the ground that emerge if donors are also willing to build in that flexibility and also are willing to build in support for care workers. So we also need to remember that people, delivering that care, the psychologists, the midwives, they need also mental health, care themselves. And that needs to be built into also the financial resources that we need for these programs.
Okay, Rasha Al-Mughani is the reporting and quality manager at Medical Aid for Palestinians in Gaza. She holds a master's degree in public health from Al-Quds University in Palestine, and she has an extensive experience in health program management with public and international organizations. Currently, Rasha is based in Egypt, where she supports the design, implementation, and monitoring reporting of MAP's response to the ongoing crisis in Gaza. Ahlan wa sahlan. Rasha, while the conflict continues, how will MAP know when the right moment to move from emergency response to rebuilding and re-strengthening? How are you planning to the transition from emergency response to
Assalamu alaikum, everyone. I'm really glad to be here today. Thanks for everyone who came here to listen to us today. There is something that just I'd like to start with, that I'm Palestinian from Gaza. I have evacuated on the 23rd of January. Until that time, I've been affected by the conflict, and I've always been discussing with myself, when is the time that I've been able to support my people. Unfortunately, that happened only after I had to leave my homeland in Gaza. And since then, I have been able to support the operations of MAP from the Egypt office. By the time that I left Gaza in January, I thought that the war is going to end very soon. And I was discussing with my family, please just let us stay here in Gaza. The war will end soon. And we had hope that the war will end soon. And now 9 months has passed so far, and the war has not ended. So the question about moving from emergency response to recovery is really hard question to answer. I don't think that there is a stage that we will say that we are moving from emergency response to recovery. So we need to start to act right now. We don't have to wait for the war to be ended. In an ideal scenario, the answer would be when there is a ceasefire. But we are not seeing this ceasefire. There is a lot of negotiations, a lot of people coming and going and traveling everywhere and discussing how a ceasefire will happen and what's the future of Gaza will be. But the war is continuing, and our role as humanitarian organizations, our role is to continue supporting addressing the urgent healthcare needs in Gaza, and also thinking about the recovery in the near future. Speaking about MAP, since the conflict started, we have following our main approach for emergency response and for supporting and addressing the urgent needs in Gaza, we started with the release of pre-positioned medical supplies. We thought that those pre-positioned medical supplies will be, this is kind of emergency preparedness. So we thought that those medical supplies will be supporting the health system to address the urgent needs in Gaza, but considering this unprecedented emergency, it was not enough. There has been a lot of coordination between all of international organizations. We have been coordinating with UNRWA, with Oxfam, with WHO, with the health cluster. So speaking about an important aspect of either at the stage of emergency response or at the stage of recovery, it's about coordination among the main healthcare providers. Also, we need to continue with supporting locally healthcare systems. Back to MAP, the approach that we are working in is about partnership with international and local organizations, but we are focusing on local organizations. During the last 10 months, we have established or renewed our partnership with more than 10 non-governmental organizations located in the north of Gaza and south of Gaza, including Lauda Hospital, of course. And we're working with UNRWA in other aspects of our work. So this is, it's about locally led healthcare systems. We need to support those or continue supporting those organizations to base their their responses to evidence based on for the needs that are on the ground. Adding to that, we need to continue fundraising for or providing the financial and the human resources for supporting the response at the current stage and the recovery in the currently and in the future, inshallah. Also, we have leveraged our capacity recently. When the war started, we were 20 staff in Gaza, but now we are 60, and we are going also to increase more. Why we are increasing, and we are focusing on Palestinians. All of Gaza staff are Palestinians, originally from Gaza, because we know that if we are to address the most people who feel the situation are the people, who are living that situation. But they are, at the same time, they are vulnerable. So that's why we need the support of other offices like our UK office, our West Bank office, our Egypt office. So this is something, I hope that this is an example for other organizations to focus on local healthcare systems, supporting the answers or the solutions to come from the ground. So speaking about recovery, this will be the approach for the future. Also, something else that we need to expand our thoughts and not to keep. We used to be. This emergency is really different from all other emergencies before. There has been massive destruction. We have never thought that we will lose all of our land. And if every aspect of or all of the infrastructure has been destroyed. So as MAP, we had to expand our interventions to not only include health and nutrition. We have expanded to include other areas. So now we are working in 6 main areas that we think that and for the upcoming 2 years, we will continue working in those areas as the main priority areas for programmatic work in Gaza. First, including the medical care, nutrition, disability, mental health, protection of GBV, and WASH and public health. WASH and public health is really needed, as you know, that because of all of these, of what is happening now, the more prevalence of infectious disease, the spread of infectious disease among the population in Gaza is really scary. So we need to take care of this part. Adding to that, we are more focusing on medical care because we're medical aid for Palestinians, of course. And it's if you are to support a country, so the health sector is the most important part of that. We will continue to deploy emergency medical teams. Until the end of this year, we will have deployed 11 medical teams, including general surgeons, orthopedics, vascular surgeons, and reconstructive surgeons. Why? Because those are the main priority areas. But also, we are in the near future, we're focusing more on the deployment of other specialties based on the needs in Gaza. Also thinking not only about the life-saving, it's all any intervention in Gaza would be a life-saving intervention. So currently we are establishing new projects in cancer care. Even MAP and other organizations, we have worked together to support cancer care in Gaza. And I was just before this session, I was discussing with my colleague Gabi that we used to implement such huge conferences in Gaza, and we were planning for the 3rd cancer conference. But unfortunately, as Dr. Ghada said, that we have reached to a stage that we are speaking about development, not only about emergency. But now the conference was planned in November, and it didn't happen. So now we're thinking about delivering cancer care, like only delivering diagnostic, only delivering treatment, only being able to deliver chemotherapy drugs to Gaza. And are we going to think about the transfer of cancer patients including breast cancer patients, particularly as women, يعني will be able to refer them outside to get their radiotherapy. We were in a stage that we were thinking that we were advocating for including radiotherapy in Gaza. So the situation is really difficult. We're comparing between pre and post this conflict. We are starting over again, but I believe that we are depending on the will of our people and the resilience of our people. And I add my voice also to Dr. Ghata that I hate those words. We don't want to be heroes. We don't want to be resilient. We're just looking for a normal, really normal life. But still, we're depending, all of the expectations were that Gaza will need 50 years to be rebuilt, at least. But I think that Gaza will need much less than that because we have the will of our people, and we will rebuild Gaza again with the support of the UN agencies, international agencies, with support of donors who are interested to support the Palestinian cause. Thank you.
Thank you, Rasha. And also, as a Lebanese person, I can echo that the word resilient gives me allergies. Like if someone says, you're very resilient people, I'm like, stop telling us we're resilient. We just want a normal life. So I echo the feeling. I would like to introduce our last but not least panelist, Dr. Yasser Abu Jama. He is a Palestinian psychiatrist who in 2012 obtained a master's in clinical neuropsychiatry with distinction from the University of Birmingham in UK. Dr. Abu Jama is a member of the task force which developed the Palestinian National Mental Health Strategy 2015-2019. He co-led the Mental Health and Psychosocial Support Technical Working Group in Gaza Strip, and in 2020 co-founded the Palestinian Global Mental Health Network. His interests include capacity building, neuropsychiatry, and advocacy. In addition to his research and contributions to authorship of some 20 academic papers, he has been certified as a trainer of trainers in the field of supervision and care for caregivers in the Free University of Berlin. Dr. Yasser, thank you for being with us. Mental health it's been documented that the burden of mental health is one of the highest across the globe and across the region for the Palestinian people. Can you let us know, your program is community-based, which is very interesting to learn about. Can you explain to us how this community mental health program has played a role in the past year?
Thank you very much. Let me begin by thanking the organizers, the moderators, and the panelists, and the audience, of course, on top of all the audience. How is your mental health, guys? I mean, being here since 8 or 8:30. It's down, yeah? Yes, of course. It should be down, otherwise you will need me, because that's how things were since the morning. But that's how things were for Palestinians for many, not days, not months, not even years, for decades. We know this. And then comes one or two questions. One is, how's their mental health? And the second is, what can you do to help them? And the third is, during the last year, what was happening really? How will you be able to provide your services? Well, I'll say just some few sentences about mental health in general, and I'll speak about the services in the last year. First of all, WHO says, and this is like in the last couple of years, some new publication, that anyone, in areas that were exposed during the last 10 years to war or conflict, about 9% of the population will have moderate to severe mental health disorders. We speak about 9% having moderate to severe mental health disorders, And that's why in many of the figures we hear that we speak about 200,000 people in Gaza with mental health disorders, possibly. At GCMHP, we look at our patients, the community of patients who come to our 3 community centers. Last year, we have seen 5,000 patients, and those come for regular therapy. It's not like one time, it's like once weekly for a number of months. And the interesting thing is that the main diagnosis that we have, and this is for the last 4 or 5 years, it's almost repeating itself every year, you know. Depression, for example, has the highest, not trauma-related disorders or PTSD. And the score is higher for women than for men. About 35 to 40% of our women patients come with depression. 25 to 30% of men come with depression. But when it comes to PTSD, it's a little bit the other way around, like 35% of men, 30% of women. Maybe the exposure of men to trauma is higher because they work, they go, they do, etc., etc. Children, the main thing that brings children to our clinics is trauma, you know. There are some other children with mental disorders, of course, but the main, like 80%, come with trauma-related disorders. And I like to use trauma-related because we don't speak only about PTSD, especially for children. We speak about bedwetting, we speak about sleep difficulties. We speak about also low school achievement, which is something that we need to keep in mind. It could be because of trauma. Anyway, we did a research, and I'll just jump to the answer, sorry about that. In 2021, like a cross-cutting, we used a cross-cutting instrument to look at the population, because our patients are not the population, these are our patients. And we found something interesting for people who are seeking health services. 80% of them, they have symptom of depression, 80. 79.3% anxiety. And the third one was anger, which was really interesting to see. And anger was about 75.4%. I'll add another staggering figure, which is 16% had suicidal ideation. These were like regular members, but we met them at healthcare centers. Okay, we looked into universities. In 2021, there is a published research, and we found that university students who should be enjoying, you know, we remember our university years, you know. These were like fun years. You don't have responsibilities, I mean, very few, but you are cared of. No, in our case, they have increased mental distress, and it shows itself in forms of anxiety, depression, and stress. Anyway, to make this long list short, when we talk about mental health, we need all the time, and I'll echo what my colleagues said, that healthcare providers are among the most vulnerable group that they increase with time. And this is really terrible. Now, GCMHP work tries throughout the years to try to respond to those needs one way or the other. The response to the needs at large, but we face challenges. Okay. Could you please go to the next one, Dino? Thank you. There are, of course, many challenges, but throughout since October, we managed to see over or to reach about 29,000 people. The schedule, please. Yeah. And we heard staggering stories from our colleagues, not the ones who speak about how difficult things are. When the panelists and when everyone was preparing for the conference, we know that most of the audience will know what's happening in Gaza. But today, really, we heard a lot of courageous, successful stories that despite all the difficulties, the destruction, that we still continue to provide services. So today, we should have to celebrate, something, and I'm glad that we have the 7 p.m. event. The main 3 services that we provide at the moment is psychological first aid, which is to the community at large. We visit the mothers, the fathers, the children in their tents, in their displacement areas. And we provide just basic support, some counseling, some education. The second one is to provide therapy, of course, for the patients. It should be a lot of patients, but actually not. And that's how usually it is. You don't see the influx of patients during the crisis time. You see it 3 to 4 weeks after the crisis time, but I think we will come to that. And then the third thing, the third intervention that we provide is the care for caregivers. And despite what's going on, we still try to provide care for caregivers for our staff, but also for staff from other organizations. Of course, in addition to that, we have the toll-free line, the telephone counseling, we have some media campaigns, something that we try to do. If we go to the next slide, which shows the buildings of GCHP, and I'll stop with that. These are our 3 buildings, guys. Tell me, can an institution survive? And the answer is no. But in Palestine, yes. We are crazy people, yes. I am a psychiatrist. And I tell people, after 10 years of being a psychiatrist, you can say whatever comes to your mind. People will not take you seriously. But tell me, who will do all of that work? Let's remember the building of Shate Public Health, Public Health Center, Primary Health Care Center, it's actually. So the picture before and the picture after, but still they see more than, I think, 100,000 patients per month. I mean, we are doing incredible work one way or the other. And finally, to come to one point, which is, when we speak about mental health, we speak about disorders. Let's not pathologize the suffering of Palestinian people. The impact of over 70 years, over 100 years, name it, whatever, since Balfour Declaration, maybe earlier, till now you cannot really put a diagnosis to that. That will be unjust to the people in Palestine. That's one thing. And let's not take the number of people who come to community mental health centers or seek psychiatric treatment as a reflection of what happens to the society. And let's not go to the extreme other side, which is speak about resilience. Let's not rejoice resilience. We know it's there. We saw it, we see it, it's everywhere. It's in our talk, it's in our heart, it's in our mind. I don't know from where it comes, but alhamdulillah, we have it everywhere. But let's not rejoice it. By that I mean, let's not speak too much about the resilience and put our hearts at calm, because that means they can, unfortunately, handle more. They can survive more. Maybe another 2 months of war, maybe another 3 months of war. The first conference was in February, and they were saying we are about to start the work. It's now 6 months later, 7 months later. How many months or weeks or days that the Palestinian people can handle? And can we continue to speak about resilience? Of course, this is another unfairness to Palestinian people. So let's try to find something in the middle between the pathology and the resilience. Thank you very much.
Thank you, Dr. Yasser. I know that Dr. Mohammed Salha is online. Is he still connected?
Yes.
Hello, Dr. Salha. We can see you.
Yeah.
Please go ahead. We can hear you.
Yes, I want to thank you about this initiative that you do it. Actually, we are at Gaza Health Health and Community Association. We respond to the health and community needs of our citizens through hospitals and 6 primary health care centers and another 8 community centers. It's in all the governorate of Gaza Strip. And actually the Israeli occupation forces, they are destroyed all of our primary healthcare center and community centers, and they are partially destroyed the 2 hospitals that we have. One hospital is in Nusayrat and another hospital is in Jabalia. It's in the northern Gaza Strip. And now, actually, I am speak from Lauda Hospital in Jabalia. Actually, the Israeli occupation forces is destroyed the health sector is in the in Gaza Strip. Especially, they are destroyed the health sector is in the northern Gaza Strip. it's during that they are destroyed the governmental hospital and non-governmental hospitals, and 1.5 months. 1.5 months there is only Al hospital is working during this aggression when the Israeli occupation is destroyed the governmental hospital, the two governmental hospital, Kamal Adwan and the Indonesia hospital is in the northern Gaza Strip, totally destroyed, and only Auda is providing the services. And you can't imagine how it's hard that we are really providing the services for all health services, and we are hospital is providing some of the specialists related to the orthopedic surgeries, general surgeries and maternity services for women and emergency services. But there is a lot of services that we can't provide, but actually we have to deal with all of these services when our injured is coming. A lot of injured is coming in one bomb, like more than 60 to 100 injured is coming to the hospital in one bomb. So we have to deal with all of these, and it's really a lot of number of injuries to deal in one time. The Israeli is actually is bombing the Lauda hospital and targeting Lauda hospital in the northern Gaza Strip 8 times. They destroyed the two inpatient departments and 2 theater rooms, actually, and they are also destroying the ambulances and destroying the warehouses for medication and medical supplies. And also they are destroyed also also they have destroyed the administration floor during the last siege that they are sieging Lauda hospital. So also the Israeli occupation is killed 3 of our doctors. It's in the 21st of November. They killed 3 of our doctors and 1 patient company. They are killed them in the inpatient department. And this doctor, 2 of them is from MSF staff, and another one is from Auda staff. Also during the siege in December, also they are killed 3 of our staff. They have sieged the Auda hospital 2 times. One time is from 5 of December till 22nd of December. And during this is also killed another of our 3 staff in the hospital from the sniper. They are really, we are living very difficult days in this time. We only eating 1 plate of rice, and we are more than 250 person inside the hospital, staff and patients. So we are living a hard situation. The doctors also forced a lot of challenges during the siege. They have doing amputation surgery for one of the patients because there is infection separate in this time, and there is no medication and medical supplies because we can't move to our warehouse to go to bring the medication and medical supplies for our warehouse because the sniper is surrounding the hospital. Really, we live in a situation, hard situation, and we can't deal. During this siege in December, also the Israeli occupation forces, they are collecting all the mail from 15 to 65 and making investigation with all of them, and also they take with them Dr. Ahmed Muhanna, and take also another of 3 of our staff with them. Until now, Dr. Ahmed Muhanna is still with them, and nobody is know what has happened with Dr. Ahmed and another of our staff. And another siege also is in May. In May, we have 13 days of siege from 19 of May till 31st of May. And during this siege, they are destroying the 5th floor, and we are taking the patient from the 4th floor to the ground floor, putting them in the emergency department to save their life because they are bombing a lot of the floors. That the highest floor, they are bombing the highest floor. So we are afraid that it will affect the life of this injured. So, and also they forced to evacuate the hospital, but they evacuate the hospital, and I am refused to evacuate all the hospital, and I am still with another 13 of my staff in the hospital with another 11 of the injured people because there is no ambulances to pick up them. I told them that we need ambulances to pick up these people, these injured, because they will die if we really not putting them in the ambulances to save their life. And I am refusing. I am still with them another 9 days, also under the siege, to save the life of our patient inside the hospital. Rauda is really worked with a difficult situation. We are working also in the conditions that really hard condition. The doctors and the nurses is really worked with a shortage of medication, medical supplies, and especially there's a shortage of fuel. The WHO always they are trying to bring the fuel from south to the north, but always the Israeli is stop them to and not allow to them to enter the fuel mission to the northern Gaza Strip, and also really we are wanting to this fuel to running the hospital. Auda is always working to provide health services. Even that they destroy our primary healthcare center, we establish another 3 primary healthcare center in the South Gaza, and now we are working to establish another 3 primary healthcare center in the north and in Gaza City, and we have also providing services through these primary healthcare services that we have one in Jabalia and one in Betlahia, and we will establish another 3 primary healthcare services. 70% of our staff is really far away of their families. Now I want to speak about my experience. Now I'm not seeing my family since the last November, and now more than 10 months, and I am not seeing my family. My children is in the south, and I am in the north. 70% of my staff like me, like that, their families is in the south, and they are in the north here providing the services. Really, it's a hard for a health worker to work with here with this condition far away with the families, and really this is our situation, and we have to focus on services to providing services for our patient. And I in the last I want to say that really we are lose everything. We lose souls, we lose homes, we lose infrastructure, but we will not lose our humanity, our molars, and our values. Thank you.
يعطيكم ألف عافية دكتور صالحة, and thank you for this intervention and for being with us. I want to go back to Miriam and I know the program does a lot of efforts to include people with disabilities. Can you talk a bit more about it?
I think that the situation for people with disabilities, we see that the fact that people have a physical disability, of course, compounds the other issues that were just talked about. So someone with a physical disability needing maternal care, or someone with a physical disability needing psychological support or mental health, it all comes together like in an intersectional approach basically to what people need. So going forward, it would be very important to make sure that full integration of people with disabilities is built in any health services, but also specifically in mental health and maternal health, so that the needs of people with disabilities are taken into account from the very beginning, and that is also looked at what is needed to make that actually happen. And I think our colleagues here can talk to this with much more detail, but I think some interventions could actually be quite easy with a big effect. If someone who is a healthcare provider or someone working in an organization knows how to work with sign language for someone who has a hearing disability, it can make a huge difference into what care this person will be able to receive, and that this person will be able to receive the right care that she is needing or that he is needing. So I think from the very beginning, if we can look at how we can really integrate that, we can make a huge difference for many people with disabilities who are in need of care. And in addition to that, also looking again at community health approaches, of the approach of community health organizations, I think that approach very much helps to reach people who are most marginalized, because community health organizations know from the different services that they provide who are people with cancer, who are people facing gender-based violence, who are people with other specific needs that therefore, their needs in terms of the medical services are even greater or need to be more specialized. So that community-based approach, both for integrating people with disabilities, but also for people with other specific situations and needs and backgrounds, I think is of major importance going forward and building, healthcare in Gaza.
Maybe also we have to be ready for the huge need that will be raised after the war and even immediate now, because we should expect that the number of the people with disability will be increased, and the need for assistive devices and all other services. Of course, we have to integrate the needs of these category within and mainstream them within the services, but also we have to be ready and put more attention to their needs in any future plans, because the needs are different now, and it's huge actually. Yeah. Okay. Now again, Dr. Gaza, for the future plans and for the recovery plan. What is UNRWA plans, and what is the challenges that you expect when you are going to implement these plans?
Okay, thank you. Talking about future plans or early recovery, I think we are doing that all of the time. Like since months, we are doing like early recovery, because we are doing rehabilitation of the health centers once there is like relatively between brackets ending of military operation, because I cannot say ending of military operation, it is continuous, but we are doing rehabilitation like what we did in rehabilitation in the health centers in Khan Younis, and we are establishing new health centers even, temporary health centers to provide the comprehensive and essential health services. So we are doing that. We are planning to have mobile clinics in order to have these, provide these essential services to the displaced persons inside UNRWA shelters and even outside UNRWA shelters in Mawasi area, which is a remote area for all of the health facilities. So we are doing that, but it is not sustainable. Like the new established health center in Khan Younis, we have three of them, but one of them, we couldn't have access to it like 3 weeks ago because of repeating of the military operations. So the main difference between what we are doing now in early recovery or in rehabilitation or continue or restoring the damaged services and the early recovery, when there is a ceasefire, is to have sustainable of like what we are doing in rehabilitation and supporting the staff, maybe we can have better access of entry of the supply. And these are the many challenges we have. We need to revitalize all of the health centers. We started to revitalize the health centers and rehabilitate the health centers in Gaza, but we don't know if we rehabilitate these health centers after maybe days, they can be damaged. And this is the difference. Like we need sustainability. We need this like unfairness and this war to have an end in order for the health persons to continue working. We need protection to the humanitarian workers. You know, the massacre happened in the UNRWA school in the north where 12 UNRWA humanitarian workers, they were working to support the displaced persons in this school. 2 days ago, they were killed. In UNRWA, we have more than 220 persons, UNRWA staff, they were killed. So there is no protection, and this is what we are talking about. So we need for the early recovery to have sustainability. We need to revitalize the health centers. We need to have mobile clinics. We need a lot of medical equipment. We lost all of the medical equipment. We need a humanitarian corridor to provide the medical equipment, the non-medical equipment. We need to support the staff, as Dr. Yasser mentioned. The staff are exhausted after 11 months of dehumanization of them, of continuous working in this very harsh situation. They are exhausted. So we need more staff, and we need to support the staff. We need funding in order to support that. We need to support such organizations like UNRWA, which is a humanitarian organization which has been attacked, and to refund and advocate to refund UNRWA and other humanitarian organizations. We need to focus on nutritional activities. The children, they are starving. They have, most of them, they have malnutrition. The women, the vulnerable group, the elderly. So nutritional activities, it is only priority, and we need to focus on it in the early recovery, and to maternal health services in terms of primary health care services and secondary health care services. During war, and I know that all of you know this, the main victims in war, they are women and children. And they suffer a lot. And we need to focus on them in the provision of maternal and child health services, and most importantly, maternal health services. About mental health services. About the mental health, believe me, the people in Gaza, they don't feel anymore. I contact with many people there. They don't feel they are human anymore. The main feature of this war is dehumanization. This is what is happening in Gaza. They don't deal, or the people in Gaza are not dealt with them as humans in front of all of the world. Forget politics, forget international laws, forget everything. It is about humanity. And all of the people with goodwill, if they are watching what is happening in Gaza without making anything to stop that, I think this is like a shame of the humanity in all of the world. And we need to stop that. We need to stop the dehumanization of the people in Gaza. When we are talking about early recovery of the healthcare system, we are talking about everything, not only about the medical services. We are talking about the people themselves. We need to rebuild the people. If we just focus in buildings and in medical supplies, no. We need to restore the humanity of the people in Gaza. This is what we are doing in UNRWA. We are doing everything and anything to restore the lost humanity of the people in Gaza. We are doing everything to dust off their exhausted souls. This is what we are doing in UNRWA. Thank you.
Thank you, Dr. Ghada. I'm honestly speechless. We have come to the end of the session, unfortunately, but maybe we can still take a question or two from the audience if anyone wants to have an intervention or a question.
Thank you. It's not as questions, but maybe, it's a comment. Because, as we know, as our narrative, our story, it's since decades, and we are under occupation. And what is going in Gaza and West Bank, we can't just speak about Gaza without the whole Palestine under occupation. But of course, Gaza, they need, the big attention there. They lost everything, and they need everything about strategy. If we'll speak strategy, Palestine different than other countries like Afghanistan and other countries where there is the wars and intervention for all the humanitarian aid or international NGOs. Palestine, they have the capacity as civil society and even ministries, and they are expert everywhere what they are doing, especially in Gaza with the UNRWA. This is the body, the civil society. In Gaza now, because we are leading bingo, I am from Palestinian Medical Relief Society. So we have many civil society organizations working in Gaza, a lot, and they are expert. They have, but they are, of course, lack of protection and lack of resources as a funding to implement. And we have also to thank all the international organizations. They are working with us because also they are many. More than 40 organizations now working in Gaza, and now we have a lot. So just one comment for international NGOs, it's not a competition, and it's not just to have money, because we need the quality work. We need to give services to our people. We are experts. We know how to work, how to do the strategy. Most their work should be on advocacy level within the international countries or their government to put pressure for ceasefire. We have to continue the advocacy on ceasefire. And also we have even, if one day as a stand or strike from all the humanitarian organization just to open the border, but we need to show this, not just a statement or just to give money because we want to work in Gaza for 6 months or 3 months. This is not strategy. So we have to put the strategy together as civil society with the health cluster and also with the Ministry of Health and UNRWA, because we can't work in Gaza without UNRWA, even on all the refugee camps. It's an political issues. So this is what we look for, a coordination and a balanced coordination between international and local, and also for quality work that we can provide our people the best. Thank you.
Thank you very much. François Saramagnan, working for Enable, the Belgian Development Agency. Unfortunately, we have had to stop our operations in Gaza because we're not a humanitarian agency, but we're looking into ways in which we could resume operations. And we're glad to have facilitated the participation of Dr. Yasser to highlight the importance of mental health in Gaza, also in the perspective of building back the community, because one of the issues that we see in the current situation as well is that the war and the chaos that has been created by the war is destroying the social fabric in Gaza. We know how, over the years and decades, Palestinians have been divided a lot by external factors. And in the current situation, with the current chaos, this is not getting any better, unfortunately. So in this perspective, mental health does appear to be so critical for the future of Gaza, not in terms only of surviving as a human body, but as a collective entity, as an identity as a society. So my question is directed to these local organizations still trying, and I'm amazed at the amount of work that you're putting together in the current circumstances. How do you see we can deal with the profound trauma that has been created over the past 11 months, knowing that prior to that, we had an estimated 80% of children in Gaza already being identified as PTSD? How could we, as international actors, be of most use, not only in terms of funding, but in terms of providing mental health interventions that can respond to that need of building back the community?
Thank you very much. And these are very important questions. In one hand, and maybe this is the beginning of my answer, people need to be educated. They need to understand what's really psychologically happening to them. They need to understand why our children started to misbehave, why my child cannot stand still, why they wake up in the night and walk around without obvious reason, why when the school year begins, my excellent child became bad at school, They need this important understanding in order to provide the needed response. So rather than yelling, shouting at the child because his or her performance is not good compared to what he or she used to be, we need to understand what could be the reason for that deterioration in school achievement. And it's well researched that this could be one of the results of exposure to trauma. So another example is why the people are angry, why they cannot communicate sometimes as they used to be, why the social fabric is not anymore strong, why husbands and wives do not have the dialogue that they used to have, why they cannot discuss things together. I mean, there is a very important role for community education. And with that, we need a big campaign to fight stigma, because it's still there. People will talk a lot for days and maybe for years about what happened to them. They will tell the stories. But are they going to tell how those stories impacted their mental health? This is a different thing, What do you feel about what happened to you? Men are less likely to answer that question. Women a little bit more. But in general, we don't have those openness to talk about our mental health issues. That's our culture more than anything else. And then we speak about the therapeutic interventions, I would say there are 3 levels of interventions, but after beginning with the pyramid of the Isaac pyramid. You start with the beginnings: dignity, life, water, hygiene, place to live, your basic rights, basic human rights, but you are not asking for something more than that. And then psychoeducation, community intervention, psychological first aid, trying to find all what's happening with the society, try to help individuals at large. Then provide at the other end, provide the specialized mental health care or therapeutic interventions. And this could be the tip of the pyramid of interventions, and we expect tens of thousands of people to be in need for that. Between those both, there is a plenty of work to be done. The WHO advises different groups of interventions that can work at the level of the counseling, providing care for people who are not diagnosed with a disorder yet. And these are plenty of scalable intervention, including the MH gap, for example, at primary health care, including self-help plus, including problem management plus. There are plenty of them, and they are scalable. And some of them do not need really very strong psychological or psychology background or mental health background. But in order to do that, in order to scale up our intervention, given that we already had very few resources trained in the field of mental health, we need to put training mental health workers as a top priority when it comes to mental health services. How many psychiatrists we have in Gaza? Less than 20. How many psychologists? More than 3,000. How many of them are qualified? Less than 100 at best. We need really to invest in training human resources. And one final thing, if I could add, because the question was asked by Enable, by my very good friend, Francois, and thank you for that. It's to the international community, sorry about this, but I mean, on one hand, we keep saying prioritize mental health. Well, yes, prioritize mental health. But on the other hand, please, I mean, keep your heads up, guys. I mean, we are the ones who are like, suffering a lot, and we are trying our best. So please, I mean, go out of the water and start breathing. I mean, it seems that the donor community at large is heavily impacted by what they have seen in Gaza going so far. But this shouldn't stop you from trying harder and harder. Resume your, let me say, support. Do not stop it. Do not make it lesser and lesser. Do not be, terrified by the numbers of buildings that were destroyed. Do not tell us we are going to wait until we see what's going to happen with Gaza. No. This is not a Palestinian issue, what we are dealing with. Let's remember what Her Royal Highness was saying. The challenge is to the international community before the Palestinian people and the head of the Palestinian people. And the paralysis that is going is not because of our hands. It's an issue for the international community to answer. It's a question to be answered and for history to document. Thank you very much.
Thank you, Dr. Yasser. Unfortunately, we have to close the session. I'm sure the panelists are more than happy to have a conversation with you during lunch or during the breaks. I also want to thank them and thank Dr. Salha, who was following with us online. So we know that the road to recovery is long and requires a lot of collaboration and a lot of communication among all stakeholders. I hope this session brought some highlights for you to think about and see how we can together contribute into the recovery of the health system. Thank you, everyone, and see you at lunch.